Veterans in our healthcare, how it can be made better. Personal memoirs not officially U.S. sanctioned. M. B. Efficiency expert with Dr. Bones, who is not real. Full disclaimer. The MB and Dr. Bones videos do not provide medical advice. It is intended for informational purposes only. It is not a substitute for professional medical advice, diagnosis, or treatment. Never ignore professional medical advice in seeking treatment because of something you have read or seen on the MB, Dr. Bones, Not a Doctor videos. If you think you may have a medical emergency, immediately call your doctor or dial 911 and tell them. No individual should use the information here to self-treat, and we do not give assurance to the accuracy of this content. The MB and Dr. Bone videos is not a part of any organization or any government United States agency. Please understand that any interpretation or information you gather here that you may act upon is at your own risk. Hi there. Welcome to Veterans in Our Healthcare and how it can be made better. Okay, I'm just a regular veteran. Tried to volunteer for the Vietnam War. Said, hey, I'd like to go into helicopters. As soon as I get in, they said, hey, we were just kidding. We were kidding. You're just going to have to be anything you want. Anyway, what I found out is after getting veterans health care, there's a lot of interesting things that probably need to be looked at. So this is one of the things that happened. The case we're going to talk about now is a person who had a splenectomy. So all the patient had done is contacted their VA doctor and said they had some ongoing left side pain that they were curious and concerned about, and they wondered if it could be a splenic artery aneurysm possibility. And the doctor repeated back to their staff, said, well, since he's had a splenectomy and had his spleen removed, we have nothing to worry about. He can't have any issues with it because he doesn't have a spleen. And the doctor didn't know that, this is a VA doctor, did not know that you could still have an aneurysm in the leftover splenic artery that's still in your body. According to the record review, patient had splenectomy, which means patient's spleen was taken out, removed in the past. Since patient no longer has a spleen, we do not need to worry about any conditions possibly related to the spleen, as there is no spleen in his system.
But in the meantime, the person who submitted their question and asked for a test just luckily happened to find the note that the doctor said, hey, he don't have to worry about this because he don't have a splenic artery. This primary care doctor was seeing a person every 30 minutes, or supposedly supposed to, right? Okay, so you got an 8-hour day and you're seeing them every 30 minutes. How many people can you see then, right? 16. So all of a sudden, you're supposed to answer all their questions too on the side. So does that sound like that's going to work out real well? No, of course not, because in those 30 minutes, each one of them is going to tell you a whole bunch of things, and you're going to have to write notes to that. You're going to have to research because they may have some sort of illness. So what do they do to kind of mitigate? They just ship you off to another expert who's going to tell you their idea of whatever the solution is, and then that's where it stops at, so that we can hedge against this possibility of lack of knowledge, is to have them have a 2-hour refresher course every week. They're at the VA, wherever they're at, and with a group, and then they go over the human anatomy, they go over the new issues that are coming along, new discoveries in medicine that are coming along, and this would make the VA doctors the best in the world.
Every VA primary care doctor needs a weekly 2-hour refresher course, teaching old knowledge and new knowledge, and learning to read x-rays better.
Now, what I'm also suggesting is that every doctor should have people doing research. So if the doctor gets a question like this, they can submit it over to the researcher, and the researchers can start going in there. You know, you take a lot of stress off the doctor, and they can do research and say, well, yeah, this person could have a splenic aneurysm. You know, that there's still a little bit of the splenic artery still left after splenectomy. You might want to call the patient in. Or you might at least want to call the patient and get more information. So let's think in terms of having a doctor who has a 2-hour refresher course every week, and then has one or two researchers on the staff that can go over patient issues, because there's a lot of things, there's a possibility that they could be missing.
Team VA, one doctor, one personal researcher, one RN, and one LVN. Radiologists need a weekly 2-hour refresher course also. The VA radiology method of paying extra to read more x-rays in a day than in the civilian sector can lead to a 31% to 53% misread rate according to studies. Numerous studies published before and after report similar error rates in diagnostic radiology. The radiologist error rate was not influenced by experience. The percentage of errors were the same among staff radiologists, 3rd and 4th year residents, and 2nd year residents.
But today, we're getting through the story of a primary care doctor who did not even know that there's still a splenetic artery after you have your spleen removed. That's the end of the story today. Thank you very much for watching.
And this is Dr. Bones, who is not a doctor. I'll get my doctor's license sooner or later.
Signing out.